And everybody, we are live today, Monday, February 22nd, I believe, if I got my calendar right. It is February 22nd, Monday. We are joined with a very distinguished guest, Dr. Michael Saag, or Mike Saag. He is with UAB. He is one of the leading experts in COVID research, I believe, and everything to know about COVID. You probably remember him from being on TV. I believe you had COVID at one time, Dr.
Good.
Saag.
Mhm.
And we've seen you on TV, and I really appreciate your time for being here with me today to really talk about. We're going to touch on a few topics as we discussed kind of before we came on. We're going to talk about a few things, but obviously it's everything really COVID related. We're going to talk a little bit about vaccines, but before we get started, uh, obviously you can give a little bit of background of yourself if you want to. I think everybody probably knows who you are. If you want to give a little bit of background, but then get into, I would love for you to start with kind of where we have been with COVID as the virus is concerned. Kind of a year ago, when we first heard about that, and everybody was quarantining and everything, and kind of where we were, and kind of where we are now with the virus as, I guess, as a whole. And what do we know now that we may have not known back then when the whole thing started?
Okay. Well, I'm originally from Louisville, Kentucky. I came to UAB for training in the early 1980s when AIDS was coming around, and I didn't have any intention of going into academic medicine. I was going to go back home to Louisville and practice, but HIV hit, and I started working with that both in the laboratory and in the clinic. And I bring that up because I think it's important to keep context in mind. HIV, or AIDS, was first described in 1981. The virus that caused it wasn't even identified until mid 1983, 2 years later. And then a test wasn't even available for that virus until 1985, and therapies weren't available until 1987, 88.
Wow.
So we're talking 7 years. And when we contrast that to COVID, it's a virus that didn't infect humans probably until the mid to latter part of 2019. It came out of Wuhan, China, that everybody knows about right now. But the sequence of the virus was identified and published to the world from China on January 10th, 2020. And from that, just 2 days later, the scientists at NIH, Tony Fauci's group, the National Vaccine Research Center, created the first candidate vaccine. The Moderna vaccine was identified and created 2 days.
2 days.
2 days in the middle of January. So it's so different. And the reason that we're so far ahead, it doesn't feel like it on a day-to-day basis. But when you put it in the context of other viral infections and pandemics, we are light years well beyond where any other pandemic has been addressed. So we should celebrate that. That said, there's a lot of misery. And
Yes.
that misery has been plaguing us, and I use that word deliberately, for the last year and probably a month. And it really kicked in, as you know, in March of last year. That's when I became infected. At that time, we were assuming that it was like its cousin, SARS-1, that affected the population in 2003, mostly contained to the Asian Rim countries. But from that, we knew that SARS-1 was mostly transmitted by droplets. And that's why our initial messaging was about wiping down surface and washing our hands frequently. But within a month, it became clear that it was airborne. And the way that I like to refer to it is that, think of anyone who's infected with COVID like Pigpen in the Peanuts cartoon with this cloud around them.
Yeah.
You come into contact with that and breathe it, you're going to get infected. So I think that we made a lot of progress. It's been a miserable 2020. I have a little mask that I wear that it says 2020 1 star out of 5. It's a bad year. So we accept that fact. But what we have is on one hand a lot of misery, and on the other hand a modern day miracle. Because as we get into the discussion of the vaccine, let's keep this in mind. Ask ourselves a question: what if those vaccines had failed? Because most vaccines that I've been involved with their development, especially HIV vaccines, have failed. They didn't work. And so the fact that we have vaccines that not only work, but work to 90 to 95% of efficacy is unheard of. There's hardly any other vaccine we have that's that powerful. So I think we should celebrate this. But in the meantime, we have to get through about another 4 to 6 months of suffering, at least in the United States.
Yeah, I think, and I'm glad you brought that up, the contrast or the difference between, the early 80s and what you obviously were heavily involved in, and thank you for that. I mean, you were a big part of that research, and you're talking about 2 or 3 years later, and we're talking about, what'd you say, a day, 2 days
Today,
after the 2 days? I mean, and that should show everybody the advancement of science and research and vaccines. And that is pretty good to put that in context. And like you said, obviously they're different, but the knowledge, I guess, and I'll ask you, is that attributed to the continual build of the knowledge base up until now? And I apologize for such a probably easy question,
no.
but it's
So think back to the space race. Those of us who lived through that era, we learned about everything from Tang to Wang, right? We had Tang, little drink that they
yep.
drank in space, and computer technologies that we on our cell phones. It's all about what we learned from the space program. Teflon came from the space program. So many things come out of our basic science research. And in the case of COVID, we are standing upon the shoulders of all the people who had done work in HIV virologies, herpes viruses, a number of other types of viruses, Ebola, and we took that and took the culmination of all that knowledge and focused it on COVID and have had an enormous amount of success. So we should celebrate that, but at the same time be mindful that our work's not done.
Yeah, and that kind of leads to obviously the vaccines and everything that you're talking about. It is pretty amazing to me, and I'm just a layperson here, to see all that work that has been done. Like you said, standing on the shoulders of the research that has been done and everything else. And that kind of gets lost with the average person, such as myself. As you think of research. Well, what research is going on? It's going on every day. And then there is no telling what we are doing today that may help us out in 15 years from now, or 20 years from now, or 30, which is pretty fascinating. So, and it is, and it's always, and you got to be thankful to the people who did the work that you were doing back then. But then even before that, obviously, and you're talking about the space program and everything, it's interesting to even look back at that to see how we got where we are today. Like you said, Tang and everything else was discovered and ended up everywhere. So do you think, you were mentioning Wuhan and how the virus got over here and everything. So you were mentioning the 6 to 7 month. I mean, we are in I guess you could say the vaccine is what is getting us closer to getting on the backside of this. Would you agree to that?
Absolutely.
And could you explain to us, as far as the vaccine, it's getting us closer to the back end of this, where what everybody wants to do, and I know you've heard this more than once, is everybody wants to get back to normal, or not wearing masks every day and all that, and doing what they want to do in large crowds. So it's important to know, hey, the vaccines are getting us on the backside of this thing. Kind of explain, in as simple terms as you can, how this vaccine works. I mean, it's 95% efficacy rate, being effective on this. Now, it's important. I mean, there are 5%, obviously, of people that it will not help. I mean, nothing is perfect, but explain a little bit of the science behind, the vaccine and the safety of it and everything, in your opinion, just about the vaccine itself. And I know there's different manufacturers making these, and you can maybe go into detail, because it is kind of confusing. You've got Moderna, you've got Pfizer, now you've got Johnson and Johnson coming in for from what I read, a single dose version. Is that today?
Mm-hmm.
Yeah. So kind of go into what is the vaccine, and I know there's been a lot of myths behind it that you've heard. Kind of explain the vaccine to us.
I think the first thing to do is take a step back and ask the question, what is the immune system and how does it work? So we've also in the last 40 years learned an awful lot about the immune system. So think of the immune system as our defense force. Our biggest number one defender is our skin. The skin is the number one defense of our body. If you take skin away, people get rapidly infected and die. So that's one. But deeper down, we have cells of the immune system. And I like to think about them as our branches of the military. In the case of fighting viruses, there's two types of cells that are very important: T cells and B cells. The T cells are kind of like the Marines. They're the first to attack. They might have special forces. And all of the immune system is looking out on the horizon every day for something that's a challenge to us, ranging from a splinter to some virus that we've encountered or something even worse. And in fact, cancer cells, as they develop, the thesis is now that all of our bodies produce at least one cancer cell a day or something like that. And our immune system recognizes and gets rid of it. And when the immune system fails to do that, that's when a cancer grows into a tumor. And that's why you hear a lot of immunotherapy in cancer right now, is trying to rebuild that. So in the case of a virus, the T cells, like the shock troops or the Marines, the B cells are a lot like the Air Force. So they're going to create these bombs, these smart bombs that we'll call antibodies. And the antibodies are targeted directly against a specific target, a very specific target. In the case of coronavirus, the one area of the virus that exposes itself most to the immune system is the surface of the cell and this spike protein. It kind of looks like this. It sticks out from the top. And the reason it's called a coronavirus is because it looks like a crown. That's from the Latin term corona, like crown. And you think of also the sun with the rays coming out. That's called the corona of the sun. This has a spike protein that comes out. Now, that spike protein it was all known from day one, like I said, on January 10th. And so the researchers came in and said, okay, we know from SARS-1 where the targeted areas are. Those are called epitopes that the antibody would be directed against. So what they did is they took the RNA from the known amount of the virus that codes for the spike, and they basically put it into just mRNA, wrapped it up in like a lipid package, like a fat nanoparticle. And so that's all the vaccine is. The Pfizer and Moderna vaccines is simply a fragment of messenger RNA that codes for a region of the spike protein that the immune system normally reacts against for coronavirus, packages it up, and then injects into muscle cells. And when it gets inside the muscle cell, it takes that cell and turns it into a spike protein producing factory. But the key point is it doesn't produce any other part of the virus, just the spike protein. And it only does it for a few days. And while it's producing those spike proteins on the surface of the muscle cell, the immune system goes, wow, what's this? I don't recognize this. And right now I'm going to go in and react to it. And then it creates an immune response that's protective against a challenge, so that later, if our body goes out, if we go out and get exposed to pigpen and we breathe in some of this virus, then our immune system, as opposed to never having seen it before, now has the entire war game plan and boom, attacks and gets rid of it before anybody ever develops symptoms. So coming back full circle, when we say the vaccine's 95% effective, what that means, it doesn't necessarily protect against ever acquiring the infection. But what it does do is, if the infection is encountered, and even if it's a transient infection, the immune system is so on the spot that we never even know that we were exposed and infected, because the immune system's taken it out. And so the 5% of people who apparently did not get, quote, protection, it's just that they develop some symptoms. But key is that those symptoms are mild. They're mild. And even in the Johnson & Johnson vaccine, which is being reviewed today, different thing than Pfizer and Moderna. So I'll go into that later if you want, but it's a different type of vector. It also has spike protein characteristics that it's trying to expose the immune system to, but it was 72% effective, meaning no one got symptoms. But of the 28% who did get symptoms, they were mild. There were no hospitalizations, none, and no deaths from coronavirus. So even if it doesn't work 100% to keep people from getting symptoms, there is protection against severe disease. And that's what we need to focus on.
And I think that is a very key point, because I have heard in reading around social media and wherever you want to get your fix of social media, any site, well, hey, you get the vaccine and you got symptoms or you got sick. Well, as you're saying, well, that could happen. However, the upside to that is there was no hospitalization from the sickness. It was milder than it could have been. And that's the point.
Yes.
The point, obviously the point would be if we lived in a perfect world, a vaccine, you get it, you never get sick again from that, one virus. But this, if you take it, which I believe in the vaccine, that you take it, it will be a milder case that if you did not have the vaccine. That's very important because a lot of questions come along. Well, people like to say, well, hey, they got you to get the vaccine and you got sick anyway. Well, listen to what Dr. Saag is saying. That's, that could happen, of course, but your symptoms are more than likely going to be milder, and you may not require hospitalization, though I'm sure there are cases that have and that will and everything else. But as far as the big number, the grand scheme of things, that it's doing what it's supposed to do. Am I right? I mean, you are seeing from your chair, as someone that has been involved in this kind of thing for many decades, it's doing what it should be doing, the vaccine.
Absolutely. I mean, so take the influenza vaccine. We get it. We're supposed to get it every year. We get it every year. And yet, it's only about 50 to 60% effective at preventing symptomatic flu. But those who get flu after having a vaccination have a much less severe case in general. But I think what you said is critically important. What we're trying to do is reduce not just the symptomatic disease, but when somebody's infected and they're very sick, they're spewing out a lot of virus. So when people are vaccinated, even if they get transiently infected, they're not going to put out as much virus into the world around them, and you actually reduce transmission as well. So we get a twofer. We reduce symptomatology and we reduce transmissibility.
And okay, so when I hear that, I mean, obviously, for me personally, this is just me speaking. I mean, I want to help out. I want to do what I can. I'm not a researcher. I'm not a physician. I can't do any of that. But if I can help with getting a vaccine, then that's what I want to do, obviously, for my family, of course. And it's very important. I think people that do want the vaccine, and some don't, and I don't want anybody to misunderstand me. It's a choice if you want the vaccine, in my opinion. I'm giving you my reason because what Dr. Saag just said, and I don't know where that's published, if it's published, and where the information is coming from. But what you just said is highly critical for me as far as messaging. Not only are you protecting yourself, but you're not putting out as much, for lack of a better term, putting out as much virus for other people to. You're not transmitting it as much for other people to get. So, like you said, it's a twofer. You help yourself. You were in what Dr. Saag is saying for those that are listening now and those that might be listening later at a later date. What I hear is, I mean, you're helping your family because you're not putting that out. And we're going to get into kind of the developmental disability community here in a little bit, but that's very important. You've had COVID. I actually had it in October. Halloween is when I got diagnosed, of all times. I wasn't a big fan of Halloween, and I'm really not now. But I think that is very important. And I think messaging has gotten a little bit lost, and really was one of the reasons why I reached out to you in the first place. Is I think messaging could be better. And I don't know if that's a state level thing, if it's a local level thing. I think there's a disconnect from even primary care physicians to the bigger picture. It's hard because, if I heard that from you, and again, I'm just personally speaking, man, that is a real reason to get the vaccine, is to help yourself out, help those around you that you love, and then help your neighbor as well. I mean, that is huge, but I don't know if that is being put out and people just don't believe it. And I understand people have their opinions about vaccines, but this is a pretty serious thing that we're dealing with. And if you can get, like you said, the twofer, that's a big deal. And I wanted to make sure everybody understands real quick. Kim Tyler, you're asking if you can ask questions. Absolutely. If anybody asks questions, if you're listening now, please ask them. Kim, thanks for listening. Looks actually, as I'm going down this list, she actually asked her question, and that's a bunch of letters. And you probably understand that PIDD COVID patients, vaccine and their response. Also, Johnson and Johnson, maybe J&J viral vector for these patients. Yes or no? Maybe you can read that and understand it. I don't understand the question. Maybe you can, and if you do, please address it.
I think my guess is what. Thanks for the question, Kim.
Yeah, thanks, Kim.
I think what it means is that if you've had prior COVID, should you get a vaccine, and what does it mean? And does the J&J vaccine
Gotcha.
work as well? I'm guessing. So you can clarify, Kim, if I didn't get it exactly.
Yeah, please.
But here we go. So someone who's had who had the infection before, we know they can be infected again. It's happened. It's not common, but it happens, and it's usually about 4 to 6 months afterwards. So we recommend if somebody's had COVID, like say on Halloween, for God's sakes, then we wait 3 months. So for you, that would have been January 31st.
Yep.
And then you're okay to get it. And I suggest you do get it. There's evidence now that's emerging that maybe one shot is sufficient. But that's besides the point. Right now, you definitely want to get the vaccine. Here's what's interesting. The immunity is measured by antibody levels are like much higher after a vaccine than after real COVID infection. Weird, right? But that's weird. It's so much more targeted and so much more efficient, so that the immunity from a vaccine is going to last in general longer than the immunity from prior infection. But if you've had COVID and then you get vaccinated, you have the best immunity there is. So definitely get that way. So Johnson & Johnson, it's typically one shot as opposed to the Pfizer and Moderna is two for the maximum protection. And the J&J vaccine works pretty darn well. It's 72% efficacious in the United States for complete block of symptomatic disease. But as I said earlier, for 28% who did develop symptoms, they were mild, and hospitalizations and deaths were zero, at least in this study. So it's worth getting.
And again, that's important to know. I mean, that's the 5% or the 28% that you talk about. I think Kim may be trying to clarify a little bit.
Common immunodeficiency.
Yeah.
Okay. So it's not completely known whether people with variable immune deficiencies will respond. We know that they often require getting gamma globulin frequently or through infusion. It doesn't mean their B cells are totally non-responsive, so it's still worth getting the vaccine. There's no harm in getting the vaccine. Whether or not there's benefit, I think, remains to be seen. Another question that comes up, not to get too deep in the weeds here, but we are talking about people sometimes who are on different medications for immune disorders. People that are on rituximab, which attacks B cells, shuts them down. Those individuals don't respond as well to either the initial infection or to the vaccine, but we still go ahead and give the vaccine in that setting.
So what you're saying is it's not for certain of these compromised medical conditions, immunocompromised positions or conditions. It's not going to hurt.
No,
somebody to get the vaccine.
The other thing I should really add to this is that not only did we learn a lot about the biology, science of the immune system and how vaccines are developed, we learned a lot about how to do clinical trials for the last 50 years. We've gotten really good at that. And so with the studies that were done for all of the above, Pfizer, Moderna, J&J, were done impeccably well. They were the best technology, the best approach, the best methodology that we have for clinical trials. They were done in a double-blinded fashion, so neither the person who got the vaccine nor the docs giving it knew who got the vaccine and who didn't, so that as people came in with symptoms, you could assess it without being biased about, well, I think they got the vaccine, so I'm going to downplay it. Didn't know. And they also had data safety monitoring boards who were overseeing the entire activity to make sure the conduct of the study was good and to make sure that everything was being reported accurately and watching out for the safety of individuals. So if there was a sudden number of cases of unexplained death or something like that, that somebody was watching out. It turned out there wasn't any surprise on the safety front, but they were there just in case. So this is impeccably done well. Final point, the biggest concern after you show efficacy, of course, is safety. And so if they could have gotten the efficacy, that is how well it worked, in just a couple thousand participants. That would have answered the question, especially with 90% efficacy. They could probably told that with less than 1,000 people. But they went on and enrolled 30 to 40,000 people into the studies. Why? Because they wanted to get a good look at safety, and they did. And now in the United States, I think there's over 40 million people who have been vaccinated, and we're not seeing anything new and different so far that the studies didn't tell us. And moreover, most of the country of Israel, almost everybody in their country has been vaccinated now, and they're not seeing any surprises. And in fact, the number of cases have plummeted so far that they're talking about getting back to a normal life. So I think the vaccine is our rescue, and I call it our Christmas miracle of 2020 because it really is miraculous that it worked as well as it did, and its safety profile is so good.
Yeah, and I think it's important. You're really talking about the confidence that the people can have that this study was done the right way. Everything, they were checking all the boxes to make sure the confidence level of the actual study was adhered to, and then obviously safety, because you do get a little concerned. I would think some people did. Well, they're rushing this. It's a rush, and we all heard about how fast this was going to go, and FDA, certain things in the FDA were going to be I don't know about waived, but sped up to the fact of where you could get this, where they could get the vaccine out. But obviously, what we're knowing today, or what you're stating today, everything was, the clinical part of it, the trial was done exactly how it should be. But I understand people's standpoint of saying, well, hey, you sped it up. You really don't know if this is going to cause this, that, or no. I think a lot of people maybe question, you hear this, that, you get it now and we're safe now. Well, what is the long-term effects in 30 years because you had the vaccine in 2021? And I don't know how you answer that question. I mean, I think I know I've heard that, and I just
Sure.
obviously haven't read really a good answer to it, but
No,
if you want to address that, go ahead.
it's a great question. It's an important one, but here's an answer. The number one answer is we won't know until 30 years from now. But what we do know is we have well over 100 years of vaccine experience. And we know that almost all of the side effects of a vaccine occur in the first 3 or 4 months after it's given. And it's not to say that it's impossible. I guess it's possible, small, but possible, that something down the road could come up. But here's what else we do know. We know that if we don't do something to ameliorate this infection, it's not going away. It doesn't magically disappear because we want it to, or because someone said it's going to be gone by a certain date. This virus is going to hang around with us for quite a while. Even once we get the vaccine implemented, it's not going to disappear. We'll be dealing with this in all likelihood for years to come, with little outbreaks here and there as perhaps vaccine immunity breaks down, and we'll just have to revaccinate. We're going to talk, I might as well talk now about variants. What does that mean? Well, viruses reproduce at high levels, billions of copies a day. That's common for almost every virus. And as this thing replicates, there's mistakes made. It's like you sit down at the chalkboard and write something down 100 times. You're going to make a mistake in writing that down. These viruses make mistakes when they replicate. And when they do, most of those changes, we'll call it a mutation. Most of those mutations are fatal to the virus. It just isn't viable. But every now and then, just by chance, one mutation gives that virus a growth advantage. And when that happens, just based on Darwin, remember back to 1860, when Darwin published, or 1859, he published The Origin of the Species, and it translates into survival of the fittest. So if that virus mutation gives it a growth advantage, it's going to outgrow the original wild type or the original virus that we saw. That's precisely what's happening. Not a surprise to anybody in the infectious disease field. We expected this. And the one that we're dealing with now is the UK variant. It's pretty common in the United States. It's going to become perhaps the most dominant species, but we know that the vaccines still work against that strain. So we're okay on that front. But that variant is about 5 times, well, maybe 3 to 5 times more infectious. So what does that mean? If I'm in the room and I'm not vaccinated, and I'm in the room with somebody who's got COVID and I can't tell, and they're spewing virus into the world around them, and I breathe it in, let's say there's a 50% chance with the original virus that I might get infected. If they're infected with the UK variant, there's a 75 to 80% chance on that same exposure that I would become infected. And that's why, while we wait to get vaccinated, we have to be extra careful. I mean, we were careful before, sort of, but we have to be extra careful now, because to me, it'd be a tragedy for someone to get infected with this virus in the coming months and die when we know the vaccine is coming. So now's the time to really steel our resistance and mitigate further spread of the virus.
Yeah, and you're referring to wearing mask, socially distancing, the whole 9 yards, as we have been instructed, or not necessarily instructed, been asked to do. Some people have been doing it more than others, and I think that's, some of the belief. But let me ask you this, and this sounds maybe like a strange question, but you, as a infectious disease researcher, you've seen this virus under a microscope, or however you doctors and researchers can see it, right? I mean,
Mm-hmm.
you've seen it. It's there. It's
Mm-hmm.
not a hoax.
Mm.
It's there, and this is infecting people, and we've had people die. And I first and foremost, when we mention that, I always want to, I'm very sensitive to that, of making sure we think and pray about those families who have lost a loved one during this pandemic. We don't want to lose anybody else. And and me personally, wearing a mask and doing what I can is one step. I think the next step is a vaccine. That's me personally. Some people are not going to agree with that, but if we've got the information, and it's not just information, and that's, it's kind of like this is not propaganda. We are talking about real science that you guys have, that you know about, that you're telling us about today, that the vaccine works as it is intended to. And now we just got to be a little extra cautious to get on the backside of this thing. I mean, this is real life stuff, and now we have the research behind the vaccine and the data to prove it.
Yeah. Let me say this, and I think there's 3 points I want to make. First, 2020 was a bad year for many reasons, but one was just the upheaval in our country, from the politics on all sides, and it really pitted us against one another. And when you're fighting a war, which we are, against a virus, it's not helpful for us not to be pulled together and working on the same thing. That was the first. The second thing is something a little bit more, for lack of a better word, pernicious or hidden, and that is the influence and impact of social media on truth. And one thing I would just implore everybody is, I would very much discourage pulling any information about medicine off of Facebook or Twitter or anything else, because you don't know the source. And trust your providers, because that's led to the third thing, which to me is the assassination of the trusted voice. That happened in 2020. And that no one knew who to listen to, because the people who we normally listen to, their voice was assassinated by social media campaigns and other things. CDC was totally undermined. Other entities that we look to pull us through these things were had lost their voice, and that hurt us. And that, in my opinion, killed a lot of people, and still is to some degree. So you could argue, well, you're in the establishment and you're part of the problem. If you think that way, I can't change your opinion. I'm sorry. But I can tell you, from me personally, I went into medicine because I believe in science and I believe in helping people. And I have no reason to do anything for any patient I see, or for anybody I talk to in this type of environment, to do anything but tell you the truth as I see it. And that's what I'm doing right now. There's no
Right.
hidden agenda and there's no other thing. But yet I've been attacked on social media, and it's uncomfortable. I'm like, what did I do? And the answer is nothing except try to speak the truth.
Well, and that's, and that is why I wanted to talk with you about it and help, get it straight from you. Not, to hear you say it. That was one of my main goals because you are exactly right. If you go out to pick your social media site or your news source, you go to one area, you'll read one thing. You take 10 more minutes and you go somewhere else and you'll hear somebody say something or you'll read something that refuted what you just read 30 minutes, 20 minutes ago. And it is hard for someone like me to sit down and make the best decisions when you're getting so much conflicting information. You don't really know who to trust. You don't know where to go to get your information. Obviously, you should go to to like you said, to your doctors, to those trusted sources like UAB and places like that. Social media may not be the best place to go, but it is. And you were right about 2020. It was an unfortunate. All the way around, that whole year was unfortunate as the turmoil in the country was at a boiling point, and we're not in the midst of a pandemic. It was some trying times, thankfully and prayerfully for me. Hopefully, we're getting on the backside. But I agree, unity. I would love to see more unity, really across the board, not just when we're talking about vaccines. We can all have different opinions. But man, unity is nice. We can come together for a greater common good, and that's for our neighbor and for our loved ones and for this country. For goodness sakes, we don't all have to agree, but unity is nice. Obviously, that is a whole different topic of vaccines, but it's an important one that you brought up. That was kind of the unfortunate perfect storm that brewed all at the same time. And we lost a little bit of that. And in your terms, saying that it assassinated the truth speakers and everybody got lost a little bit. I'm hoping that now we're kind of guiding back in here. And I know, again, I've mentioned it before, vaccines are always a topic of heated discussion amongst other people, but that's why we're talking about it today, getting it from Dr. Saag to say, here is the truth. Dr. Saag has no hidden agenda. There's nothing being told except the truth and what he knows. And I want people to hear that and make the best decisions for not only themselves, but for their neighbors, for their loved ones, and help us get on to the backside of this where we can, like you were talking about Israel, getting back to a little bit of normalcy, getting there. That's what we all strive to do. Nobody wants this pandemic, and we definitely don't want people to die if we can help prevent that, for sure. We have a question from Amy Young. She's asking Dr. Saag for when we get to the subject, I guess, which I guess we'll go now. When is the projected time frame for pediatric vaccinations being available? Thank you, Amy, for tuning in and asking your question.
I would say by May. The studies are well underway now, and the real question, of course, for all vaccines, like we talked about, is safety. They just want to make sure there's no unexpected issue for children, for kids under the age of 16. My guess is that there won't be anything seen. One thing you have to work out is what's the right dose? How much do you give? So that's one thing they're working on as well. But I think by May, maybe even before that. So what we're going to see in rollout, because I know we want to get to that, is right now we're in a supply problem. Everybody who is into the notion that a vaccine is going to get us out of this is clamoring for a vaccine. I've gotten it, but my wife hasn't gotten it yet. And I refuse to pull strings to get her in front of anybody else. She's going to wait in line like everybody else. But I think in the next 6 weeks, 8 weeks, most everybody who's really in line to get their vaccine will start to get it. And by May, not only will most people who want the vaccine be able to get in line for it, the kids will be getting in line for it as well, such that when we get into May, June, we're going to have an interesting transition from a supply problem to a demand problem, meaning there'll be more vaccine available than we can maybe even use, but there's going to be, pick a number, 20% of our population who are going to say, I don't want this vaccine under any circumstance. And as Dustin said earlier, everybody has a choice in this. It's not like that you have to do it. But I think what we need to do is have more conversation about the safety. I think the efficacy is just over the top effective, but the safety is always going to be an issue. And there are people who don't get flu vaccines every year, I get that, but we really are going to be focused on getting the most accurate information to people as we can, so that I think we can get embroiled into the staging of release of the vaccine right now, the 1A, the 1B, the 1C, et cetera. But really, I think in 6 to 8 weeks, it's going to be moot. Everybody who wants a vaccine will be able to get in line for it pretty soon.
And I hope you're right. And a lot of this is great discussion, and I think I know part of this discussion that really hits home with me personally is really the developmental disability community. Now, I've read studies that say that those with intellectual and developmental disabilities, that group of people, a lot of those individuals may be at higher risk for developing a more serious form of COVID, or maybe more health complications that are a higher risk. I would love your opinion on that and what your knowledge is. I understand what you're saying. In 6 to 8 weeks, this could be a moot point. In May and June, but we're here now. And just for the people listening right now, or maybe in the future, because there are certain developmental disabilities or medically fragile kids. I have one myself, though she is not 16, she's 10. But there are parents that want to protect those kids, obviously, with vaccines that may or may not be able to get the vaccine. Some of them can, some of them cannot. And then there are those that are old enough, that are adults, that may be at higher risk due to a developmental disability. And if you could just touch on that of what
Sure.
and my part of it is, I can read the phase 1A and phase 1B and phase 1C, but it gets confusing a little bit when you see other states. They've specifically listed some of the developmental disabilities in there that saying, hey, these, and then when you look at your state, that really the only thing that really captures it to me is like high risk medical conditions, which could be up for interpretation. And maybe that's why they wrote it that way, but just would love your opinion on that.
Sure.
And what we do know about that specifically today.
Yeah. Well, let's pull back again and think conceptually, then we'll get into the details. So, conceptually, the spirit of rollout of the vaccine was meant to get two large groups right off the bat. Those people on the front lines every day seeing patients with COVID and dealing with them in some kind of way, and the people at highest risk. And then the concentric circles went out from there to the broader community with 1B, 1C. But everyone, I think, kind of gets that. Let's talk about what is high risk. We've only had 10 months worth of experience of really bad illness in a lot of people. And what we looked at was who's more likely, once they get COVID, to go into the ICU and potentially die. And the answer to that is people who are over the age of 65, people who are obese, that is, they have a body mass index of greater than 35. What does that mean? They look overweight significantly. That's how you would know it, right? People who have underlying diabetes, people who have other disease states, sickle cell anemia, things that put them at higher risk. Interestingly, racial minorities were at higher risk of being in the ICU. I can't tell you right now whether that is genetic, but I think it's more of an issue of access to care. Like a lot of things in medicine, social determinants and differences between haves and have-nots in terms of access to care matters in terms of having outcomes. But it's true that Black Americans have more likelihood of being in the ICU, very disproportionately to whites and Hispanic individuals as well. Those are things that we know. Now, we can start to parse this a little bit more by people over the age of 55 who have had blood pressure, a little bit higher risk. And then you get to the thing we've been talking about. Do people with developmental disabilities, are they at higher risk for developing severe COVID? And the answer to that isn't crystal clear. Partly because there's such a wide spectrum, right? Going from Down syndrome to other things, and it depends on functionality. There's mitochondrial disorders. There's so many things, and so it's also intellectual capacity in some kids, because if they're not able to clear their secretions well, or if their cough is impaired, of course they're going to be at higher risk of having a problem with any respiratory disease, including COVID. So it's hard to sort of lump it together. But my bias is that I would like to see people with any kind of disability or impairment be in line ahead of people who don't have such disabilities. And then they're caretakers as well, because if the caretaker isn't vaccinated, they could be bringing it home. Or flip it around, if the caretaker gets very sick and ends up in the hospital, that creates a major problem for the child, of any age, frankly, who depends on that caretaker for their day-to-day functioning and existence. So yes, that all is common sense to me. Fortunately, the supply is picking up. And let me make one other quick comment about
Yeah.
supply, that I think we can give a tip of the hat to the government and the last administration for doing this part well. So back in March of last year, March, April, it became clear that we had two vaccine, or more, actually, there were 40 or 50 vaccine leads that looked like they had legs and might be successful. The normal way that drug development goes and vaccine development is you go through the studies, you prove efficacy. And at that point, in this case, it would have been December of 2020. At that point, the companies say, okay, we're going to invest our $1 billion right now to build the plants. And there's usually a gap of anywhere between 6 months to a year between the time that a drug has the data that shows, yeah, you've got a home run here, and the actual production of sufficient quantities. Now, what happened back in April of last year is that our government said, we're taking that risk on. And they gave the companies with the best data so far up to $1 billion plus to build their factories last year, so that when, if at that point, but now we know when their vaccines were shown to be efficacious, they were already in to the production of the vaccine. So we gained an entire year because of the forward thinking and the investment that was put into what's called Operation Warp Speed. I think that's an unfortunate term, because it says to people, we're rushing through this and we're going to give you something that's unsafe. No, it just meant that everybody was acting quickly. And it reminds me of tennis. When you're playing tennis, you want to be quick, but you don't want to hurry, right? And
Right.
any other sport. So I think we can celebrate the fact that the good decisions were made last year in the midst of all the political chaos.
No, and again, and I'm glad you brought that up, because I think a lot of people, such as myself, um, don't really understand what warp speed meant. Now, I understood FDA approvals and all this because I just have some familiarity with it, but didn't know, as what you just mentioned, that we gained a full year with that. Just imagine if we were a year away.
Mm.
And kind of, so yeah, kudos to the decision makers and the past administration that did that, and it is just a matter of it. To me, it hits home when you say, obviously for the kids, and it's got to be safe. But then if we look at the adults, and really you look at the caregivers, because you mentioned, and I want caregivers to hear this. It is very important that, obviously we've said this at least 3 times at this point. It's your choice to get a vaccine. I get it. But please take it seriously when you're a caregiver, because you're the primary caregiver, and you could be, not obviously you're helping yourself, but if you're the primary caregiver and you're down for a certain amount of time, or even worse cases, you might die, then who does that leave for your loved one? And that is very important. That's an important point to make. It's also important that I am in line with you. If we have certain people with disability that they should be a priority, in my opinion, over someone like myself. Um, let's get these people that are more susceptible to either a worsening case of COVID or death, or whatever the data is showing us, and move them to the front of the line to get what they need. Because in my opinion, all human life is important in these things. There's really, I hate the word priority. I, I don't necessarily, I mean, it's a priority. I mean, what person is a priority of another person? Really, to me, we're all important. Now, I understand the roles that we play, healthcare workers, first responders, but man, we are all a priority in this. And I hope people are listening to what Dr. Saag is saying about the efficacy, the safety, and then also go back and listen to what he said about the 5% with the Moderna and I believe the Pfizer vaccine, and then the 28% with the Johnson and Johnson. It's not that you get this vaccine and there's 28% that it just didn't do anything for. There is still data and research, and the science shows it is helping you. It's actually helping you. It's helping your neighbors. It's helping everybody. So please go back and listen to that. We had a couple more questions. One from Michelle. What is your opinion on organ transplant patients and bone marrow transplant patients receiving the vaccine? And I appreciate you listening, Michelle.
Yes, everyone, they should get it. There's very few people who should not get the vaccine. And in fact, I don't want to use the word priority, but they should be getting it sooner than later, because people that have a compromised immune system because they're trying to prevent rejection of an organ or a bone marrow or whatever, they're gonna have a harder time fighting. In other words, we talked earlier about the defense, our immune system being a defense system. Well, to prevent that rejection of the organ, we tie one of the arms of the immune system behind our back. And it's a balance between how much impairment of the immune system do we need to keep the organ functioning, the transplant, versus putting that person at risk for infection. And the entire science of transplant medicine goes back to the 60s, maybe even the 50s, when they've been dealing with that delicate balance. So those folks who have transplants of any sort should be getting the vaccine. There's no risk to them because it's not a live virus. It's just a little fragment, of the messenger RNA, and there's no way it can cause an infection on its own.
Yeah, so the answer is yes, get it. Now, I'm curious on what your previous statement of there's very few that should not get it. Do you wanna
Yeah,
kinda touch on that? Maybe that's easier for,
right.
people to understand and get?
Right. I think it boils down to just one group, and that's people. The one ingredient which is in this vaccine is called polyethylene glycol, PEG, and it helps stabilize the lipid nanoparticle. And so there are people who have allergy to that. There's some possibility that there could be some latex that gets into in very small particles as part of the processing. So somebody has an exquisite sensitivity to that may have a reaction to the vaccine in the form of an immediate type of reaction. But we're watching for that. Every time somebody gets the vaccine, they are observed for 15 minutes afterwards, every single person, looking for those two types of reactions. And that would be the most hazardous. But there are very few reactions because there aren't that many people who have that type of allergy.
Yeah, and what I hear there, and again, trying to make this as easy and understandable as we can, or for me to understand it, is so when a person gets the vaccine, the shot in the arm, in the shoulder, then they are observed, and any adverse reaction that you're talking about will be observed within that 15-20 minute time frame, and then they can address that
Yes.
reaction.
Right. To be more specific, that's a type of reaction. It's called an anaphylactic reaction. It's an immediate reaction where face swells, throat can swell, trouble breathing. All that's an immediate thing that if it doesn't happen right away, it's not going to happen.
Yeah.
Now, that doesn't mean that people won't have a sore arm. Most people do. Some people get fever chills and last for about 24 hours, but it's no different than, say, the Shingrix vaccine that a lot of folks have gotten for shingles. One other thing I'll just add parenthetically, we tend to sort of look beyond the years before we were born, and we don't pay much attention to what happened. But you think about it, people used to have large families back in the 1800s and early 1900s. Why? Because a lot of kids didn't make it to adolescence. They died of polio, or they died of smallpox, or they died of measles or mumps or rubella, or you name it. And we don't do that anymore for a lot of reasons, but one of which is that because of vaccines that our kids get, they live to adulthood. We prevent a lot of those major diseases. In Africa right now, 12 years ago, 15 years ago, 20 years ago, when I first started working there, kids, the number one cause of death of kids was rotavirus, simple diarrhea. They would get a rotavirus infection, they would become volume depleted, and they would die. And now with the rotavirus vaccine, those deaths are all but eliminated. So vaccines work when they're properly designed and implemented well.
Yeah, and that obviously, again, as I've said before, that the vaccine discussion, any vaccine discussion, always can be contentious for people, and I get that. Me personally, for anybody listening, and I say this, I've said it many times before. I put my faith in God first, man second. So maybe you have to pray about these things, and really look at it, and then look at what I consider. Uh, Really looking at the data, listening from Dr. Saag, and really, making the decision for yourself and praying about it, and then deciding. And it sounds like to me, again, that the data is pretty, really lopsided, that this does help. This vaccine does help this situation, and regardless of what people think of other vaccines, the data is here. And listen to Dr. Sag, and I'm pretty sure that there's article upon article upon article that can be seen or read that shows that too. But I'm not. Nobody is saying, and I never want anybody to think that it is, like we've mentioned, it's a forceful thing. It's your choice. If you want the vaccine or not, that is your choice. The data is there that it shows that it helps. It helps your neighbor, it helps yourself and your loved ones. Back to the caregivers. Again, please, if you're a caregiver, for a disabled person or a medically fragile child, please consider getting the vaccine. Look at the data, listen to what Dr. Sag is saying, and make those decisions with the best data that is out there. That was one of the main reasons I wanted you on, Dr. Sag, is to give us that and let us hear it. Again, obviously, you're very well respected and trusted source. So this is one of the better sources to listen to. Social media and other outlets may not be. And regardless of any of your other beliefs, and as far as the politics of things, try to, I don't know, if you want to set those aside and read the real data, read it and listen to it. So I really hope that point gets across today about the vaccines, and I hope I'm praying as well that you are correct, that in 6 to 8 weeks, and this is per Dr. Sag, that 6 to 8 weeks there's going to be enough supply, because that's what you hear now. That's what you will hear if you email the state, and I have. There's just not enough supply right now to get everybody the vaccine that they want to get it to. And then that's when I do give a little pushback, and I admit it. Well, we need to get it to those that are most vulnerable. And so what supply we do have, while I understand there are positions that are really needing it, then you hear of people getting it that you're like, how did they get one and not this person over here? So, I guess that's the system that we're in. This is the state we're in. And I know Dr. Harris, and I'm just saying what he emailed me. They're going by the CDC guidelines. That I have posted that email out for anybody listening to this on my own page, and you can read that. So I'm not putting words in Dr. Harris's mouth. That's what he emailed me. It's out there for transparency purposes. But I just wanted everybody to hear it from you, Dr. Sag. And I told you I would give you an opportunity, because everybody listening to this, I read on his Twitter profile that I don't know if he thinks he's funny to himself, or maybe his wife thinks he's funny. I don't know. I wanted to give him an opportunity to be a comedian, or tell us a joke or something that maybe that's a better aspiration. You've done great work, but maybe it's the comedic life you really wanted to live.
I'll finish with a disclaimer and refer to Yogi Berra as we close. I made that prediction that, let's say, by May, the vaccine supply should be open so that most people who want it can get it and begin, getting it out more readily. So I'll quote Yogi Berra to end, and that is, he said, "Predictions are always difficult, especially when they involve the future." So that's something to think about as we close. And
Yeah.
I could be wrong, but that's my best
Well,
guess at
let's
that.
hope.
Yeah, amen.
Well, let's hope and let's pray. And listen, I want everybody that, and I thank you for everybody that tuned in today and that people that listen to this, just do your research, look at the data, make your choice. And again, try, like we talked about earlier in the conversation of the golly, the turmoil and everything that's been going on. Let's try to, come together and look at this thing, look at the right data, obviously, and then make the best decisions. And I'm a big believer in prayer and putting faith in the right source. And then secondly, we put our faith obviously in the data, the best data that we have. And I think we heard that today. So Dr. Saag, and that is the correct pronunciation of your last name, Saag. I made sure I didn't want to mess that up. I really appreciate your time, Dr. Saag. And anytime you ever want to come on and just, talk and maybe you want to do a ventriloquist show or something, I'm not real sure. Feel free to hit me up and we'll put you on.
Yeah, you bet. Well, thanks for having me,
Hey,
Justin.
thank you.
Yeah.
Yes, sir. Thank you very much. So guys, that concludes today. I hope you got something from that. The main reason to bring the best information to you guys. And I hope those that have listened today got something from this conversation of really what are the facts. What are the facts? And I think it was a very profound statement, man. It depends on where you get your information. Well, we just had one of the leading COVID researchers in our state at UAB, an absolute expert in his field, giving you all the information that you need. So everybody, put your faith in the right place, in my opinion, and God. Pray about it, and let's make the best decisions, not only for ourselves and our families, but for our neighbor. So until next time, this has been Dustin Chandler with Dr. Saag. See you guys later.